Hello, welcome to the Better Together podcast. My name's Mike Baker. I'm with Heritage Health, and we're going to be using this podcast to talk about healthcare, talk about North Idaho, building community. We're so excited that you're here with us. This is actually our pilot episode, so you're getting us at the very start of a really cool adventure. Today, I'm going to be talking with my good friend, Jeff Conroy. Jeff's been a staple in the community for a very long time. He's actually kind of old and has lots of wisdom. And so we're going to have a great conversation today. So how about we just get into it? All right, well, listen, welcome everybody. I am so excited to be here with you today on the first episode of the podcast for Heritage Health. We're calling this thing Better Together because really, isn't that what it's all about? Like, we are better together. We live in an amazing community, and we're going to use this podcast as a way to talk about things that are happening in the community. We're going to connect it back to healthcare. We're going to have great people that we chat with and really try to build some community with a podcast. What are you thinking about the podcast? Are you excited?
I'm pretty excited for this. This is going to be a lot of fun. I appreciate you asking me to be a part of this, and it's going to be fun being the guy in the chair.
I know. I was thinking about like Jimmy Kimmel and all those other people. They always have the sidekick out there. I'm like, I think we can really make fun of Jeff in this thing. So hopefully he knows what he signed up for.
Yeah, I've got an inkling.
Yeah. Well, our goal really is with this thing is to spend about 20 minutes, 30 minutes each week. Today we're going to talk about just like why we're doing this and what that's all about. And then we'll be bringing in people from the community. We're going to be asking them questions about, how their organization is functioning within our community, how that floats back to healthcare. I think it's going to be really exciting.
I'm excited. I'm excited to bring the guests in and get their perspectives on things, and maybe we'll all learn a little bit of something.
I hope so. And then I think the other thing, we'll do, we really want to talk about a lot of the conversations that we just aren't having in healthcare. So, like, as you know, at Heritage Health, we're really trying to do things differently, with the Center for Healthy Living, with the way that we're looking at primary care from a different lens. I'm hoping that we can actually have some really interesting conversations about healthcare, but like there's so many challenges in the healthcare system. It's really expensive. It's hard to access. We've got some great patient stories that really, I think they inspire all of us to be better. And I'm really excited about that. And I know, as you've been giving tours at Center for Healthy Living and, interacting with the organization, I mean, you've seen a lot. You've seen Heritage Health do a lot.
Yeah. No, and it's been fun. That's my involvement with Heritage Health, as I believe in what's happening here and the work that's being done and the way it's being done. It's totally different than the standard medical services that are happening. Doing the tours at the Center for Healthy Living, I've had community people coming in, and it's amazing what they don't know about what Heritage Health is and what they do. Been around for 40 years.
Yeah,
but it's interesting that what people don't know. So it's fun to have that educational piece.
It is. I mean, I think, we talk in the board meetings frequently, and the board members are like, how come people don't know about us better? And again, we're just like, we've been this hidden secret in our community. We take care of 20, 25,000 patients a year. There's a lot of things happening. But I think like one of the things that I love about this place is we get to see real people all the time. I mean, our patients are incredible. And you hear the stories of just, the patient that, they're all alone and they're struggling with a mental health condition, or they're homeless, or, my family instance, right? We've got a lot of healthcare challenges related to women's health. And we always have a provider or somebody from our team that just steps up and shines, when we need them. And I think that when you look at the healthcare system, I think that's the thing that we always have to focus on is just the experience in the healthcare system. And I know we've not been perfect, right? I mean, we're always trying to do better. But I think this is another avenue where we can talk about the healthcare system and, bring people on. I'd love to have our providers on and interview them,
Yeah.
and like, so people can see why they do this, because the why they do this is really what matters.
Yeah, and from my perspective, it's dealing with the homeless population and those in deep poverty, and I'd work real closely with the street medicine program and watch the street medicine team go to work and provide the services and getting people healthy, because those people have a rough life, and when street medicine can come in and take care of the current issues right then and there, and then watch them leave happier, healthier, with a plan. So that's kind of fun to
Yeah.
watch.
No, they really do some magic. Well, we should probably, because since this is our first episode, and then we talked about how people don't already know
Right.
who we are, and because we're using this format, we're gonna reach like all of North Idaho,
Yeah.
because of this. So maybe we should talk a little bit about actually who the heck we are and
I don't know.
what this is all about. What do you think? Does that sound like a good idea?
That sounds a great idea. Who
Okay.
are you again?
Huh?
Who are you again?
Oh yeah, we've had lots of names over the years.
Well, I've had a few for you.
It's been pretty good. It's been pretty good. We've had lots of names over the years, but we are Heritage Health.
Yeah.
And I think it's really cool. When we were coming up with the name, we had formerly been called Durney Community Health Center. That was based on our founder, and Lidman Durney was on the board when I was hired. And when we made the name change to that, it was really uncomfortable for her. It was not anything that she wanted. And after she passed, we thought, how do we come up with a name that honors her legacy, but she's not still mad at us because we named it after her.
Right. And you're doing her proud.
We are, and that was kind of the goal. So we chose Heritage Health, really reflecting like the big heritage and honor that she's really been part of the community, and I think that really stuck. It's been fun to see that name pick up. Now I think we're always going to be known as the Durney
Durney
Clinic,
Clinic, yeah.
right?
Yeah.
That's just who we are, and I love it. It's great that it's sort of like knowing the secret menu at Fire, and you get better pizza out of it. But it's really fun when you've got that name tied to the history. But it was really cool. Let's talk about kind of how this started, like why Lidwin started that. I know you're very familiar with that story.
Yeah. Why it started?
Yeah.
I mean, I remembered driving by the old Durney Clinic on Ironwood, and the line of people that were being there, because they were only open 1 or 2 days a week.
Yeah, it's like 2 days a week.
Yeah. So Ludwin wanted to make sure that the people that didn't have the insurance to get medical help were getting help. So she really started the very first community health clinic in Coeur d'Alene to provide services to those people that can't afford medical insurance. And since again, I go back to when did I move here? 1995.
I don't know, you're really old, so I don't know if you even remember
dirt.
that.
I'm basically me and dirt. But I remember when the Durney Clinic started and the lines going up and down Ironwood, and Sandy Momola, when Ludwin and Sandy Momola started the Durney Clinic. I mean, that's their legacy. That's what Heritage is now. It's the legacy that they started. And when Mike got here, he pretty much put the Durney Clinic on steroids, and now really services 3 counties and multiple cities and 23,000 patients, and really does a great job.
It's so cool. There's such a power in the organization that I think really was it. It's because of where it started. When I look at the volunteer energy that's there, and that I joke that Lidwin, just like her energy's just in the DNA of the organization, and then you tap that into this really cool community that we live in. We just had the holiday parade, and I've talked about that. That was like my first experience with this community was coming up right after I'd had an interview. It happened to be the weekend of the parade, and Jacob, my son, we went down to Sherman, and we got to experience the end of the parade, the singing of Silent Night, and the fireworks. And it was just like this magical thing that I'm coming up to this community that gets together and does these small town awesome things.
Right.
And it's just like you take the DNA of Lidwin and the energy of all the volunteers, and then you match that to a community, And you look and, see like what we do in this community has been really cool. We provide medical, dental, mental health, substance use treatment services.
Yeah.
We have a pharmacy program.
Yeah.
Got locations in Coeur d'Alene, in Post Falls, in Kellogg, in Rathdrum, and in St. Mary's. Our street medicine program, they actually have mobile units, so they get to travel everywhere. When you think about the primary care system, our job is just to be here for you no matter what.
Right.
And I think, as we've been building out the Center for Healthy Living, that is going to be the future of primary care. You're going to show up, and under one roof, you're going to be able to access all of the services, but not just another medical clinic. It feels like home. It feels like you belong. And then we match that up with, let's think about primary care differently. Like, this isn't just a place where you're going to show up and we're going to say, here's your pills for your diabetes. And of course, we're going to take care of that. But let's think about it differently. We know that our bodies respond well when we eat a little better, when we exercise, when we're focused on taking care of our mental health, when we're building community. I think sleep's in there somewhere. Yeah. That's one I've personally been trying to figure out. But when you combine those things together, it's really cool. And so in Center for Healthy Living, and I think what everybody's going to see in the community as the Center for Healthy Living develops, is you're going to see this thing come together where we have this space dedicated to helping people learn how to exercise, learn how to eat better, build community. And that's all wrapped inside your primary care clinic. I mean, that is the secret recipe for just incredible things to happen for the community.
And that's where the frustration is of, you've been around for 40 years and people don't know about Heritage Health. I mean, our community, the number one industry is tourism. So there are a lot of hotel workers and restaurant workers and service workers. So a lot of those people can't afford insurance or afford really good insurance. And that's why I don't understand why Heritage Health is such the secret, because they do have all the services available in one location to serve our community. I just think it's a great resource. We have other medical organizations in this area, and they all serve an amazing purpose. But there's a population in our community of 150, 170,000 in Kootenai County that really could benefit from the services of Heritage Health. They need to seek those out.
I think it's really cool. And I think I've been here I'm starting my 16th year, and just watching it go from, where we were and to where we are now. I think you have these phases of an organization where I think we're hitting almost like early adulthood now. Like we finished college, we've learned a lot. We bought the house, right? And we're just like ready to settle in and be, just continue to be here for the community. I mean, there's going to be some amazing things ahead.
Yeah.
And, we've had so much growth in our community over the last little while. And so I think, the people historically that have needed our services, they find us and they know about it. And we're well known in many circles. But we had a physician that worked with us a little while ago, and I mean, he had such a big heart for the work. But one of the things he would say all the time is, we're going to build a healthcare system that's so great that, even patients with health insurance want to come. Really referencing like what we can do when you bring all the resources together and just serve the community. We don't care who you are, how much money you have, whatever it is. Just show up, and we're going to take care of you, and we're going to have a sort of this toolkit available for you of provider types and services and just different experiences, so that we can help you live a healthier life. And we go back to sort of the mission of the organization, right?
Yeah.
I mean, it's very simple. I think there's just this beauty in the simplicity of the mission of the organization.
Yeah.
Yeah.
No, I agree.
So now that we're talking about sort of the history of the organization and all that, I talk about sort of the simplicity and beauty inside the mission of the organization. I love how the board of directors, they came up with it. They wanted something. They just said, our mission is very simple. It's just to improve life.
Yeah.
And, when you look at that, and when you look across the nonprofits in the community, the other healthcare providers, we're all kind of united around that same thing. We just want to improve life, and I think it's pretty cool.
Well, and that's where the collaborative effort comes in with Heritage Health, and we're doing more of it. And I think, because you're right, I think we all want to improve life in our own way. It's just working together and working towards that mission.
Yeah. No, I think it's going to be great. Well, I mean, I think this podcast is going to be a really cool tool for not only Heritage Health, but again, for the community. We're going to try to keep these episodes like 20 to 30 minutes. We want to have real conversations. There'll probably be some where we're going to talk for 4 hours, and we're going to, just line up there with Rogan on a deep day.
I'll be listening.
It'll be great. But I think as we go through it, we want these short bites that they should be inspiring. They should inform people about what's happening in the community. And I think overall, it helps us really connect back to the mission. Like, we're going to improve life by providing great healthcare, but we're also going to talk about it and make sure that everybody knows what's happening so that they can access services and, challenge us. I hope people leave comments and, like, invite some dialogue back into this. And if you want to be a guest on this incredible podcast, let us know. It's going to be great.
Well, and they should reach out. If they've got questions for us, they should leave the question with us. Is there a phone number or an email that they can email at?
Yeah, we actually have this an email set up.
We never discussed that. Sorry.
What's that?
We didn't discuss that.
That's all right. Hey, see, I'm on top of it.
Okay.
But we do. We actually have a podcast. It's just podcast@myheritagehealth.org. And we'll put that in the show notes. But I think that'll be a great tool for people to reach out and if you want to be a part of this joyous adventure we're on, that'd be great.
Yeah, I mean, if you've got any comments, if you have any suggestions, if you'd like to be a guest, if you want something explained a little bit better, to understand a little bit better, please reach out at podcast@myheritagehealth.org. Please do that. Yeah, it's a community podcast. And the way this podcast becomes more useful is by getting community participation.
Jeff, thanks for being here for like our first episode today. I think we're going to look back on this and go, what a bunch of goofy, bald-headed, crazy guys. But I think hopefully we're starting something really special here. And I appreciate all the work you've done in the community. You've been a big part of the organization. Thanks. We have amazing people that work here. And I think we're so lucky to have that. And I can't wait to highlight those types of things and just really tell our stories.
Yeah. The people here at Heritage Health are amazing. They're just incredible people. So it'd be fun to tell their story.
It's really the secret. So, all right. Well, we'll come back next week and we're going to have some amazing things to talk about. It's going to be great.
It'll be awesome.
It'll be awesome.
See you next week.
All right. See you next week.